We will discuss the vascular tumors associated with skin, which are very important in step 2 CK. So, first is strawberry hemangioma, which is a superficial infantile hemangioma. The most important thing, strawberry is liked by infants, so it occurs in small people, that is infants and children, most common benign vascular tumor, and composed of capillaries which is separated by connective tissue. So it is usually superficial and well demarcated and blanched with pressure. When it is near the epidermis, it's bright red. When it is deeper, it's more violaceous. Mostly on the skin, but can also occur in deep tissues and viscera like liver. It occurs during the first few days to weeks of birth and initially grows up to 1 to 2 years it grows and then regresses spontaneously by 5 to 8 years. Management main is observation. In some patients, topical beta blockers can be used because of high risk of complication like ulceration, cosmetically sensitive area, example face. What does propanol do? It involutes the blood vessels or capillaries by causing vasoconstriction and inhibiting the growth factor in the area. The complications can be disfiguring by ulceration and scarring, vision impairment if near eye because of strabismus from eyelid hemangioma, and it can also be life-threatening. Life-threatening when there is a tracheal lesion. Cherry angioma or senile hemangioma. Cherry is for old ladies. So it is like cherry appearing. Her cheeks were so cherry, my grandma. So cherry angioma or senile hemangioma, most common benign vascular tumor in adults, first seen in third to fourth decade of life, and number increases with age. It is always cutaneous, never in the deep tissue or the viscera, and it does not regress. If does not regress, it may eventually bleed if disruptive. As we can see in the figure, the cherry hemangioma is sharply demarcated area of capillaries and post-capillary venule. Treatment not needed other than cosmetic. Now, cavernous hemangioma or cavernous malformation. It consisted of dilated vascular spaces with thin-walled endothelial cells. It is soft, blue appearing and compressible mass growing up to a few centimeter. It appears on skin, mucosa, deep tissues and viscera. Cavernous hemangioma of the brain and viscera are associated with von Hippel-Lindau disease. Cavernous hemangioma, in diagram we can see cavernous hemangioma of the conjunctiva. Pyogenic granuloma is a benign vascular skin tumor. It appears as bright red papule that grows rapidly over weeks to months to a pedunculated or sessile shiny mass. Common locations are the lips and oral mucosa. It can also bleed with minor trauma because it is pedunculated. As we can see, bright red papule that is pedunculated mostly, or can be sessile also. How we can TD it from AV malformation. AV malformation is composed of all three things: veins, arteries, and capillaries. So it is purple red patches with visible veins on the side. And it can be often warm because, and also a palpable thrill or audible bruit can be present. Now, angiosarcoma is a very rare malignant tumor. It is the first malignant tumor that we are discussing, and it arises from the internal lining of the blood vessel or the lymphatic vessel. It can be primary when it occurs spontaneously without any predisposing factor present in liver and breast, or it can be secondary. Example, if there was a breast cancer and was treated with radiation, radiation increased the risk of angiosarcoma. Angiosarcoma is often confined to the skin only. Uh, it can cause chronic axillary lymphedema, often precipitated by surgical lymph node resection, which is non-pitting. It appears as multiple ecchymosis and purpuric masses on the skin, breast, axilla, and upper arm. It appears 4 to 8 years after breast cancer therapy. Secondary angiosarcoma leads to early metastasis and caused lung mets, dyspnea. It's high grade and has poor prognosis. Confirmed diagnosis by skin lesion biopsy is important in this case because it's malignant, and treatment is surgical resection. Thank you for watching. Like, subscribe, and share for more such videos.